Hello, everyone, and welcome to the first Learn series brought to you by Genomics Ireland. This is a series dedicated to exploring the latest discoveries in genetics and genomics and the world of precision medicine. In these sessions, we are going to bring on leading experts to discuss topics such as the science behind new methods of treating diseases to the nuances of diagnosing genetic conditions and some of the latest discoveries in the field of genetics that can transform our understanding of human health and diseases. The kind of guest speakers you're going to hear from includes pioneering genetic researchers that are on the leading edge of innovative studies, thought leaders in drug development translating scientific breakthroughs into practical healthcare applications, influential figures from academia, research institutes, and patient organizations pioneering innovative approaches to enhance access to genetic information within healthcare systems. I'm Indrila Das, founder of Genomics Ireland. My mission is to propel the transformative potential of genomics in shaping the future of healthcare. I'm driven by the vision of democratizing access to cutting-edge genetic insights and fostering collaborative efforts across scientific, medical, and technological realms. Genomics Ireland is a place where we focus on new ideas, scientific advancements, and making sure everyone gets the benefit of genomics fairly. Whether you are a healthcare professional, scientist, a precision medicine expert, a leader in a genetic testing program, a patient, or simply someone curious about genetics and precision medicine, this series is for you. Your time and attention are greatly appreciated. If you find our discussions valuable, we encourage you to share the series with a friend and invite them to join Genomics Ireland. Your support helps us reach a broader audience. If you have ideas for future topics, suggestions for guests, or if you would like to provide feedback, do not hesitate to reach us. You can email us anytime at info@genomicsireland.com. Your input is important to us. Hello and welcome to Genomics Ireland's Learn series. I have Monisha Sebastin today with me. I've known Monisha for almost a decade now, actually over a decade, and it is my honor to introduce her to you. So Monisha is a genetics professional with expertise in clinical care, leadership, and research. She received her bachelor in genetic engineering from SRM University, India, and Master of Science degree in Human Genetics, Genetic Counselling from Sarah Lawrence College, New York. She is the Senior Genetic Counselor at the Children's Hospital at Montefiore, where she specializes in pediatric genetics, rare diseases, cardiovascular genetics, immunogenetics, and research. She is the 2023 President-elect of the New York State Genetics Task Force and co-chairs the USIGC Subcommittee of International SIG at NSGC. She was the recipient of the 2022 Heart of Genetic Counseling Award. She serves as an advocate for and strives to be a resource to fellow international genetic counselors and aspiring students. So without further delay, I would like to hand over to Monisha from here.
Thank you so much for the kind introduction, Winsula, and it's my honor to be kickstarting this series that you've put together for the population in Ireland. So today I'm going to be talking more about my profession, genetic counseling. I do not have any conflicts of interest to disclose. Any statements or comments made throughout this presentation are my personal views and do not reflect those of my affiliations. In my day-to-day life, I use American English, so I've made an active effort to adapt British English for this presentation. However, if there are any spelling differences that you notice, I apologize in advance. So today, the objectives for our talk is going to focus on reviewing the process of genetic counseling, list the different work environments of genetic counselors, elaborate how a genetic counselor can help individuals and their families. So let's start with genetic counseling. It is a unique and specialized STEM career where the process involves helping individuals and or their families understand and adapt to medical, psychological, and familial implications of genetic contributions to disease. Now we are moving into the genomic world, and we are learning more and more about the non-coding aspects of the human genome that are contributing to disease. So I guess moving forward, we should be saying genomic contributions to disease. And the process of genetic counseling is performed by individuals who have an advanced training in medical genetics and counseling. And these individuals are called genetic counselors. And given their training, they are prepared to offer personalized care to their patients, providers, and individuals seeking assistance in understanding their genomic health. So, genetic counselors use their genetics expertise to equip and empower patients and physicians with information to understand one's genetics health risks. Genetic counselors help individuals explore various genetic testing options that might be right for the individual and offer guidance in making well-informed choices to understand what the genetic test may mean for the individual and or their family members. And they, given their expertise with counseling, which is the training is a bit different from that of what one would go through in a psychology or psychiatry training. So the counseling aspects of genetic counselors is used to provide emotional support to individuals while they're making important decisions, and in sharing the information with their families and in understanding what this would mean for their family members. And so it's more of an emotional support and guidance that the genetic counselors offer with their counseling expertise. So the components of genetic counseling would entail interpretation of family and medical histories, and genetic counselors might talk about the different test options to assess the chances of a disease occurrence or recurrence in an individual or their family. They would educate individuals about inheritance testing, management, prevention, if any, and resources and ongoing research opportunities that individuals can participate in. And they offer counseling to promote informed choices and adaptation to the risk or a new diagnosis that the individual is given. So, genetic counselors work in countless healthcare settings to improve the lives of people with known or suspected genetic conditions in many ways. So, there are more than 20 specialty areas in a variety of work settings, and genetic counselors hold different roles in these work settings. And the statistics that I'm going to show is more focused on the population the population of genetic counselors in North America. Majority of genetic counselors who are in the clinical world are have reported to practice in cancer or oncogenetics, prenatal genetics, and pediatric genetics. The other areas that genetic counselors specialize in the clinical world is vast, and I'm just highlighting a few that are offered at the institution that I work in, which includes assisted reproductive technology, cardiogenetics, postmortem genetics, neurogenetics, disorders of sexual differences, biochemical genetics, adult genetics, and hematological conditions. So the areas of practice, although majority of genetic counselors are in direct patient care roles, some genetic counselors do not work with patients. And you might see them working in laboratories, in government institutions, not-for-profit or patient advocacy support groups, biotechnology or pharmaceutical companies, universities. And they might be involved with writing test reports for genetic testing companies, interpretation of those results, and offering telemedicine services to providers who send genetic testing for their patients, conduct or assist with research, teach in medical or graduate school, guide and manage business decisions, or create or implement new laws, policies, working with policymakers and lawyers, on policy and legal statutes specific to genetics, genomics, or genetic counseling. And as our understanding of the human genome improves, the settings, jobs, and the roles of genetic counselors will also continue to increase. And this was, I think, one of the most positive aspects of this profession is nearly 9 out of 10 genetic counselors who took the 2023 survey reported that they're very satisfied with the profession. So this is a group of individuals who really love doing what they're doing. So how can a genetic counselor help you? Genetic counselors, as I mentioned earlier, work in different clinical settings. And I'm going to focus more on the clinical settings where genetic counselors can be helpful. And as I highlighted earlier, genetic counselors do work in non-clinical role. In the interest of the population that we are focusing for this talk, I'm going to focus more on the clinical aspects. So prenatal genetic counselors, one can choose to meet with a prenatal genetic counselor if there are any birth defects or genetic conditions that run in the family, or if someone has difficulty getting pregnant or has experienced multiple miscarriages or lost a child at a very young age, or they're currently pregnant and they're wondering what are their genetic testing options. Or they might want to understand and obtain guidance on interpretation of tests that were previously sent by their physicians, or to assess the risks to the current pregnancy due to any abnormal or concerning ultrasound findings. In the cancer setting, individuals might approach genetic counselors due to a personal and/or family history of cancer, or a diagnosis of cancer at an unusually young age, diagnosis with more than one type of cancer, multiple individuals in the family with the same type of cancer or same group of cancers. And in the pediatric world, individuals might meet with genetic counselors for concerns such as intellectual and/or developmental delays, multiple congenital health problems or birth defects, like cleft lip and palate, a hole in the heart, which is usually called as atrial or ventricular septal defect, or multiple concerns in different systems of the body, metabolic disorders. This usually is something individuals might have heard about newborn screening, which is very common in the US, and the number of conditions on the newborn screening do vary from state to state, and this is becoming more prevalent across the world as well. However, I do acknowledge the number of conditions are different. So if there are any babies who are picked up on the newborn screening with an abnormal finding, they might be referred to a pediatric genetic counselor. Vision and/or hearing loss from a young age, or that's progressive, and then family history of a particular genetic condition, known or suspected genetic disorders. So the other reasons, besides the three main specialties that I mentioned, one might consider meeting with a genetic counselor is concerns or confusing results from direct-to-consumer genetic testing. The direct-to-consumer genetic testing are tests that are directly accessible to individuals without having to go through a physician or a genetics professional. And the most common one that individuals might be aware of or might have seen on TV or ads is 23andMe. And any health conditions can have hereditary components, meaning it can be something that's running in the family, such as heart disease, neurodegenerative disorders like Huntington's, birth defects, progressive or young onset hearing or vision loss, diabetes from a young age, and I'm more focusing on type 1 diabetes and not type 2 in this aspect, kidney disease, young or early deaths due to known or unknown medical conditions. You might hear family members say, oh, they were doing something and they suddenly passed away. Any sudden death that has no explanation should be something that could be explored further, especially when it happens in a young individual. And also deaths in sleep, where you might hear family members say, yes, she was young, but then she passed away. She had a peaceful death in her sleep. So there are some conditions that present with sudden death during sleep. And so that's something to keep in mind. Immunological problems, unique skin findings, and frequent fractures. These are just a list of few that are most commonly referred to genetics. But if there is anything else that's going on, you see a trend in your family where there are multiple family members who are presenting the same way, and you feel that there might be something genetic going on, you can always request a consultation with a genetics professional. So, what can you anticipate if you plan to go meet with a genetic counselor during your visit? So, the genetic counselor is going to do an assessment, and this is done by asking you what is your reason for why you're meeting with them. And they're going to talk about expectations of what you are anticipating to gain out of that visit. And they would also tell you what the reality is of what the genetic test options are and what that would mean for you and for the rest of the family. They will obtain a detailed family history and medical history of the individual who is presenting to the clinic or who is the main reason someone is presenting to the clinic, and physical examination, particularly in the case of some adult onset adult conditions, and also some mostly pediatric patients, which will be performed by a trained medical geneticist. And then the genetic counselor would go over what are the different test options that's best for the individual. They would talk about genetics, inheritance, educate you on what genetics is, what genetic testing entails, what's going to happen, the types of results you can expect after after the testing is done, potential implications of these results, meaning what this would mean for the rest of the family, legal implications, which again varies from state to state, country to country, and data storage and sharing based on the lab that they're sending the test to. And once the test is sent, it typically takes about a month or two to come back, depending on the type of test. Some tests do take a few months to come back. The genetic counselor would talk about what those results mean for the individual, what it means for the rest of the family, what type of inheritance is associated with what was found, and who else in the family, if any, should be tested, and what is the management. Are there any treatments? Majority of the genetic conditions, at least in 2023, there is no cure. However, treatments are available. So one might ask this question of, so why would I go for genetic testing if there's no cure? I know I have these problems. The benefit of doing testing, you can think of it as equipping your providers, your care team with a pair of glasses to see you better, to anticipate what concerns can come up in the future. Because some conditions can present with symptoms or features later in life. And based on the results, a genetic counselor might also provide you with support groups or information, like Facebook groups that would be helpful in coping with the diagnosis, and referral to other doctors or other specialists who would be beneficial in the care of the individual being assessed. And throughout the process, the genetic counselor will be offering psychosocial counseling and helping you make informed choices. And in no means is anyone required to do genetic testing. It is the reason genetic counseling happens is so that individuals can assess, is this right for them or not? When it comes to genetic testing or decisions related to genetics and genomics, there is no right or wrong. Everyone is entitled to make the choice that is best for them. And today, there are thousands of genetics tests every day, and the numbers are increasing with our knowledge of what different causes of genetic conditions are. And not all genetic counseling visits entail genetic testing. Like I emphasized, after discussing the pros and cons of genetic testing, one can decline genetic testing. So the number of visits with a genetic counselor, depending on the purpose of the visit and what's being discussed during the visit, can vary from just one visit where you meet with a genetic counselor just to gain an understanding and knowledge of what your options are. And if you decide to do further testing, it might go into a second visit where you discuss the results. And if there is a significant finding from the testing, there might be a third or fourth visit where you discuss testing other family members. And sometimes once a year, once in 2 years, if there is a diagnosis, to just keep in routine check of, is everything okay? Are your labs okay? Are you meeting with the appropriate doctors you should be meeting? Are you getting the right care? Is there anything that we can do in the form of saying, writing a letter in support of therapies or treatments that might be helpful for the individual? So how to best prepare for your genetic counseling visit? When, as you might appreciate from my previous slides, it is a lot of information that's going to be gathered during your visit with a genetic counselor, unlike other routine doctor's visits. So the individual who's being evaluated, or if there's a family member who is the main reason you're going to the doctor or to the genetic counselor, it's helpful to have all medical information ready, which can entail what diagnosis does this individual have? What were they presenting with at the time or before they were diagnosed? How did this diagnosis come about? What age did they get diagnosed? What tests were done? And if there was any genetic testing done, it is helpful to bring those test reports, especially for individuals where, say, for instance, there is a family member who got tested and they call their cousin and inform them, hey, I spoke with a genetic counselor and they told me that you should be getting tested for this particular finding that they had in me. And if you have some family members who reach out to you saying, you should get tested for what I got tested and what they found in me, it's always helpful to request their test report, because we usually like to send testing to the same lab for the family members. And if that's not possible, at least share the test report with the lab that we would be sending testing to. And in this day and age where I think, especially post-pandemic, telemedicine and also Google access to the internet has become more common. So individuals might go online, read about the conditions or read about the genetic aspects of certain diseases, and that might leave you with a lot of questions. Feel free to bring those questions or any clarifications or concerns you have, and a genetic counselor would be more than happy to clarify those questions for you. And some of these visits can be emotionally draining. So it's always helpful to have a support system with you, which can be a partner or your spouse, your family members, such as your parents, or even a friend, if you are comfortable sharing in-depth personal information in their presence. And sometimes it's also helpful to have this other party with you who can jump in and add information that you might forget in the moment. And when I looked into the statistics of genetic counselors in Ireland, this is from the Irish Times and from a publication from 2020. There are about 16 genetic counselors working in public and private sectors in Ireland. And the statistics from one of the top hospitals, it appears that majority of genetic counselors see patients for cancer, rare disease, cardiac conditions, and cystic fibrosis. In the case of non-urgent referrals, the wait time is about 14 months to 2 years, and which is pretty similar in other parts of the world as well. And I think this is where Genomics Ireland becomes a very helpful resource to not just the genetics and genomics community or the workforce, but also the general public. And I am greatly impressed that Angela has taken this initiative to create more awareness of the field of genetic counseling. And as a friend, and I'm impressed and very much in awe of her efforts. And I hope this network serves as a resource and tool to the lay people in connecting individuals, not just researchers, geneticists, genetic counselors, but also families and offering them support and the appropriate healthcare that they deserve. With this, I'd like to conclude my presentation, and I'm happy to take any questions.
Thank you, Monisha, for such an insightful session. I am very excited that we have started this series because the first session was extremely, extremely good. And I'm very sure that whoever would have access to this information on Genomics Ireland or in general would really get a lot of value in it. In the interest of time, I think we can only take two questions, and I can assure all the other questions that we have got, we will post them, like with Monisha's answers, in a different forum on the Genomics Ireland group. And for now, the two questions that we have is the first one: how can advancements in genetic testing contribute to personalized healthcare plans for individuals in Ireland or in Europe?
So the advancements in genetics, I think with more and more work that's being done in diverse population, we are getting a better understanding of the different genetic variants that are seen in different population. So population genomics is taking over, and there's a lot of good work that's being done. So there's better understanding of what a diagnosis could look like for different population. However, when it comes to cure, we are still working towards that. And we are still working towards helping individuals better. At this time, most of the treatment or care is symptomatic, but there is benefit to that. As I highlighted earlier, getting a diagnosis can make a huge difference in the lives of individuals who have been fighting all their life to advocate for themselves, advocate for the care that they deserve. Of course, this is going to vary across the world based on the healthcare system, based on how the healthcare system functions. But with more and more work that's being done, it also leads to more and more researchers working on understanding the mechanism behind the genetic change. So I hope that answers your question.
Of course. Thank you for that. And the next one is a more general question, I suppose. So how can we get more information about our options for genetic testing in prenatal or cancer settings in Ireland?
I think that's a great tie-in with what Oindrila is doing right now, where she's creating a forum where she's trying to bring in everyone in the genetics and genomics world to this common platform where they are accessible. The best people to ask about what are the genetic testing options, I would say, are genetic counselors or geneticists, because they're more in tune with what's happening in the field, what are the different advancements, the research, genetic testing options, etc. So I would recommend joining Genomics Ireland and getting more understanding of what the testing options are. Besides that, if someone is interested in getting a counseling from a genetic counselor, I would think there are also telemedicine or telegenetics companies that are there that you can reach out to. A Google search might be able to help you in identifying those options for you, because as I pointed out, there are so many genetic tests, and the genetic tests are usually picked based on the individual's medical presentation, family history, taking into account all the history. So it's important that you talk with a genetics professional before proceeding with genetic testing.
Thank you, Monisha. I think I would just echo what you said, that what we are trying to do in Genomics Ireland is really create that platform whereby anybody who really doesn't know what a genetic testing is or what are his or her options can openly ask those questions, and we have a network of experts, of course, and we are kind of creating this community so that these kind of questions and answers become more accessible for people, and they can take advantages of those forums. So with that, I think we're coming to an end of this session. I would again like to thank Monisha for her valuable time and her continued support for Genomics Ireland. And I hope that we'll be back again with another session from Genomics Ireland. And we would love to have Monisha again back for another incredible topic.
Thank you so much for this opportunity, and I wish you the best in this.
Thank you so much. Thank you, Monisha. Take care and good luck. And we'll see you again.
Thank you.